For months, we've been telling you about what the Arizona Attorney General calls one of the biggest fraud cases in state history. Rehab clinics set up for Native American patients accused of overbilling the state Medicaid department or even failing to provide any services at all. More than 100 companies have been cut off completely, not allowed to bill for Medicaid payments anymore.
Tonight, Team 12's William Pitts talks with women who said that they benefited from the program and now need a new place to live.
I was a functioning alcoholic till I couldn't function.
Kimberly Liston is a Navajo tribal member going through treatment as a single mom of 4 kids. She chose ICANN Healthcare and Services for one big reason.
Because that was one of the reasons why I didn't want to go to treatment, because I didn't want to be separated from my kids, you know? And so when I started talking to her, she assured me, she said, you'll be fine, you'll be with your children, you'll be able to not have that stress of trying to figure out how you're going to pay rent. I can help you with that, and you can focus on your kids.
ICANN says it focuses on rehab while keeping families together. Nicole Mitchell is the owner.
I decided to do families only because the kids needed a safe and healthy environment.
She says she set up a treatment center for Native Americans and also helped them find housing and ways to pay for it. In May, she was notified she was cut off from access, unable to bill the state because of allegations of fraud. The Arizona Department of Health Services says ICANN was billing excessive hours per person, accused of billing more than 24 hours in a day. Mitchell says if she made mistakes, she wants to correct them.
They just sent us a letter and have us start reaching out, looking for answers. I don't know how I got caught up in it. I can't tell you. I know that we didn't do anything wrong.
Since losing the Medicaid payments, Mitchell says her clients are about to lose their homes.
A lot of them had stable housing through nonprofits. And the problem is now the nonprofits, there's no resources available. So the clients are going to lose all their housing.
I was called by somebody from Gila River Healthcare telling me I need to think about a plan B and a plan C.
Bernadette Campos is a Gila River tribal member and an ICANN client. She doesn't think her housing is in jeopardy, not yet anyway, but she has 5 kids and doesn't want to worry that her treatment may be shut down.
This situation is just horrible, the whole situation. I understand there's really bogus programs out there, but this one is not one of them.
Thank you for calling 211 Arizona.
Mitchell says she hasn't been able to find any places for her 24 families.
Please press 1 for assistance.
She called the 211 hotline, set up to deal with the fallout of the Access fraud investigation.
Do you have any immediate placement?
The operator told her there was temporary shelter for families, but they'd have to call a meeting to figure out what to do with so many of them. And the operator said each client would have to call themselves to be screened for placement.
Well, you can hear the concern in their voices about this. Was there a plan for housing these displaced people?
DHS says there was a plan, and it was the 211 hotline. And we've actually asked a lot of questions about the 211 hotline. How many spots were available? How many people have been helped with this? How many spots are available for families? And we haven't gotten any of those numbers. DHS sent us to Access. Access just said 211 is available to help people.
All right. Yeah. Well, this is, the most basic need is a place to live. So it's a big situation. All right. Well, thank you.